Good morning, I'm Jessica Lovell, and welcome to the Morning Medical Update. There are many rare diseases that can be treated, but only if the patient gets the right diagnosis and finds the right doctor. Today, we are learning more about a disease that can be physically and emotionally draining to patients and take years to get diagnosed. It's called Cushing's disease, when a gland inside your brain throws your hormones out of whack. And for the woman we're going to meet today, it led to weight gain, facial hair, and eventually a surgical procedure that went up her nose and into her brain. We'll explain why it's so important to find the right doctor sooner than later. We are joined by Dominique Christensen, who was diagnosed and treated for Cushing's disease back in 2020. We also have Dr. Rudy Karnchanasorn, an endocrinologist here at the University of Kansas Health System, who helped diagnose Dominique. So we're glad to have both of you here with us because Cushing's disease is something we hear a lot on our program when it comes to other issues and health diagnoses that people are having. But to find out exactly what it is going to be really interesting today. So Cushing's, it involves the pituitary gland, which we can see here in this illustration, a tiny gland at the base of the brain. So Dr. Karnchanasorn, what does the pituitary gland do? First off, start with that.
So pituitary gland is like a master gland in the body. It regulates the target glands elsewhere. So we're talking about Cushing, so we focus on adrenal glands, which are two glands above your kidney. And adrenal glands secreted multiple hormones, but one particular to Cushing is cortisol. I'm sure you know people heard a lot about cortisol.
Yes.
It's one of the stress hormone. It's a hormone you need to generate energy. But on top of that, pituitary regulates other things. So pituitary regulates your thyroid glands to make your thyroid hormones. It regulates the ovary or testicle to secrete a hormone for sexual, function, and then it also regulates growth hormones. So it's pretty much master.
Yeah, the master gland. You said that, and so if that's out of balance, it can cause all sorts of issues,
yes.
Trickling down the body. So how does Cushing's disease make the pituitary go kind of haywire?
So for Cushing disease, it's when you have a pituitary tumor that secreted too much of a hormone called ACTH. And ACTH is the hormones that control production of cortisol in the adrenal glands. And if you have too much of the ACTH, then you have too much cortisol. Like I mentioned earlier, cortisol is important. Cortisol is one of the stress hormones. We cannot live without cortisol. But too much amount from the tumor can cause significant effect, and they're mainly debilitating to the patients with the condition.
So Dominique, you said we could call you Dom. So Dom, we said that you were diagnosed back in 2020, but when did you first start noticing those symptoms? What were you noticing?
Well, in 2017, I was really big in working out, and yet I still was not losing the weight. And that was after I had two of my both kids. And then in 2019, you can see it in my stomach. I have definitely got larger than I had ever been, and even like when I was pregnant with my children. So I was like, hey, Dr. K, let's try to figure something out to help me with this weight loss. We did other things like Saxenda, but it just wasn't really working. And then I just got like, and then I was always tired. But I also have thyroid disorder because I've been seeing her for that for a while. So we're trying to just figure out what exactly is going on. So we did multiple tests to try to figure that stuff out.
Well, and that's really smart because you're like, weight gain, fatigue. I mean, kind of like gets wrapped up so much, especially as a woman, and you have kids and you're running around but then you're working out and you're like, but this isn't making sense. I'm working hard. I'm watching what I eat. So smart that you knew your body, but why so it causes this weight gain? Does it happen in certain parts of the body? She mentioned her stomach. You mentioned cortisol, and I know I've seen all those commercials where they say, "Oh, you have too much cortisol that is around the tummy," when they're talking about like weight loss remedies. So does that have a correlation?
Right. So typical for Cushing syndrome or Cushing disease is cortisol caused truncal obesity. So meaning your belly, they can have something called a buffalo hump in your neck. So all in the trunk, and in fact you have skinnier arms and legs, which is pretty different from other kinds of obesity.
And that's exactly what you were noticing, right?
Definitely the stomach, maybe a little bit of my neck, but I mean, I know I've seen worse on other people, so I was just thankful that maybe I was doing the right exercises to not get that back look, but I might still have it. Who knows? I try not to look at my body. So, what was your question?
That's okay. It's early, and it's Monday. No, but were you noticing kind of what she described? You mentioned the tummy, but she mentioned like that you're just gaining it in certain parts. So sometimes when people gain weight, it's in the face and the hand, and you feel it all over. But you were feeling it really right in the center.
And then I was getting like red marks on my stomach because of that stretching marks. I'm like, that was supposed to be just when I'm pregnant, not as an adult. But I'm also gaining weight, so I know that body stretches and it gets those red marks.
Yeah, but you were like, I'm working out. I'm trying to do all the right things, and this isn't supposed to be happening. So it kind of triggered you to get to see a doctor. Is it normal? Is it tough to get diagnosed, Doc? I mean, I'm gaining weight. That could be almost anything.
Right.
So how do you know?
It's one of the toughest diagnoses for me as endocrinologist is diagnosed Cushing. So for Dom, because we met earlier and we did talk about increased facial hair, difficult losing weight. So we did check some of the marker, which reflects adrenal androgen. Adrenal androgens are hormones from the adrenal gland that produce certain quality for like increased facial hair growth, body hair growth type. If you're thinking about like male, male has more hair because they have more androgen. So we did check that marker back in 2017, and everything was fine. We didn't even, we did even screen for Cushing then, and everything was fine. But I remember when Dom came back to the clinic, and I saw that stretch mark. So the stretch mark for Cushing would be purple. People have stretch mark all the time. They deliver and they have like white, thin stretch mark. The Cushing stretch mark are dark purple and they're wider.
Interesting. I wouldn't have thought of that.
So I was like, oh, this is different. I have not seen that, before. And then we did run the test, and it was just very abnormal. That's really something that was different.
So you needed to run the test before you knew for sure it was Cushing's,
absolutely.
but you knew something was different here.
Right. And the test was like clearly off because it was fine a few years ago.
So Dom, were you then referred to an endocrinologist? Talk to us about that. Were you told to, is it my understanding you were told to lose weight beforehand?
So I was diagnosed with thyroid disorder in '97. So my primary care had been covering me for years. And then after, it was either after my first or second pregnancy, because after the miscarriage, I think my doctor decided, hey, let's just see an endocrinologist. I can't recall, but when I look in my chart, you can see 2013 and forward that I've been seeing Dr. K. So it had been somewhere around there. And then, so her and I have been just seeing each other for quite a while.
Yeah.
And then, if I have questions, I advocate for myself, which I advise every patient to do.
Yeah.
And I'm like, this is just not right. And things have just been spiraling more that I know something's wrong. And so I just had to get the answers, and there was a lot of tests to do. Overnight tests, the saliva cortisol test. You have to put cotton in your mouth. That's a special cotton that is in a pre-made tube, and then that gets shipped off to be ran for your cortisol level that is seen around 11 and midnight. And you can only do it those times. And then in the mornings, I would have to come in for the random cortisol testing at around 8 o'clock because they want that morning one. and you are not supposed to have any steroids and stuff. So I was having a lot of back issues at that time.
Injection.
So
Right.
I had to really monitor going from when am I going to get my back injection, when am I going to get these oral tests or random arm draws to coordinate that my cortisol level is not going to be too high due to those back injections, that it's actually going to give us an appropriate result. So for my case, I had those different factors where I had to make sure.
So that it read right. You need to make sure you're reading those tests
So
right.
it's like, do I do my back injections or do I get my cortisol testing done this week or whatever? And
Lots
those
of-
are hard to get scheduled. So
Well, that was my question, is that we hear all the time out here about getting screenings, kind of a one and done test to find out if you have something. Why so particular with all these different types of tests and they're being sent off and then you got to read this and then you got to make sure everything
Have to be at this
is
exact
timed out.
timing.
Yeah, why the timing
Absolutely.
on this particular
Right.
disease?
So we're talking about cortisol hormones, and there is a character of cortisol. It's called diurnal variation. It means that you have the most cortisol when you get up in the morning. So of course, if you're shift workers, you work all night, then your morning's different. But in general, the diurnal means it's different throughout the day. So it's highest in the morning, lowest at bedtime. And if you want to see if something is too much, then you need to check it when it's supposed to be low, meaning that if you check in the morning, you don't really get, to the point that it's supposed to be low. So when Dom was doing these tests at night, this is because at bedtime, for people with normal schedule, you would have the lowest level of the cortisol. Another test that worth mentioning, so there's 3 screening tests. The reason we have 3 is none of that are good enough just to have one, and you need at least 2 out of 3, and for each particular test, you should have at least 2 that was concordant, meaning that, for each test, you needed to repeat it and it's repeatedly abnormal. So 2 out of 3. So one, we talk about cortisol, salivary test, because you do it at night, it's supposed to be low, you check it and it's high, then it's off. Second test is called a dexamethasone low dose suppression test. It's when you take a steroid pulse at night, and of course it's so important to ask your patient, have you been using steroid? It could be steroid inhaler, steroid creams. We don't want that to interfere with our results. The injection is different because it lasts a little bit longer. So you can't just stop and have the injection one day and then the next day go do the test. You have to wait, several weeks or a few months to get that because the injection lasts in your system. You don't want anything interfering with your test. And so you take the low dose steroid, and then in the morning at 8, so steroid would normally suppress the cortisol production in normal people, but not when people have Cushing because they're out of control. So even the steroid would not work. And then if we wanted to check if someone's making too much cortisol, you can do 24-hour urine collection and check that free cortisol levels, which means that it's of course not the most convenient test to do because you have to pee in a hat and collect all the urine the whole day and at night time, every time. And then once you're done, you just drop it off to the lab, and that is to test. And of course, you need it 2 out of 3, and you need each test to be repeated twice.
But even after these tests, you still need a brain scan.
Absolutely.
So what do the CT and MRIs show on Dom?
So Dom has very tiny tumor, like 2 millimeter lesion in the pituitary, and that's not it for her because if the tumor was not obvious, I have to explain this, it's not uncommon if you had a head scan and find a little bit of something. It's actually pretty common, over like 10% of the people, and most of the time that is not the cause of their problem. So we call these things incidentaloma. So once you have, an evidence that you have Cushing, and we think it's coming from your pituitary, which is, more common cause of Cushing. Then you had an MRI, and if the MRI didn't show anything obvious, so obvious mean, you see any tumor that large enough, the cut point right now for now is 6 millimeters. Hers is like 2 millimeter, very tiny. So to confirm this is not a fluke, we have to do additional tests, and that test is called inferior petrosal sinus sample, just to confirm the ACTH, which is that hormone that's off, is coming from the pituitary and not outside of the pituitary. So rarely it could come from your lungs, rarely it could come from somewhere else.
Dom, how is this affecting your day-to-day life? Go ahead, take a sip. I would imagine the testing, that's all over the map, and you're having to stay on top of that. But just the day-to-day symptoms, while you were trying to figure out what it was to when you're trying to get some type of treatment, how was it affecting you?
It's a little stressful.
I think so.
And then that probably also increases my cortisol level. I mean, hello, stress, cortisol, those all go up high, right? So thankfully, I have a great support system of my family and at work. And so they were really good about helping me get to those appointments that I needed, and or being able to watch the kids so I can go do those things.
So you do all of that. You go on to have surgery, correct? Mm-hmm. So why was that the preferred treatment for Dom, doctor?
So main treatment for Cushing would be surgery if it is something that we know, we can go after, because that would be the most successful modality of treatment. And we have really good surgeons here in our hospital, so that's a plus. It's very important to have, someone who has been doing this for some time and had high volume, because, surgery comes with complication, and you really need to seek the high volume surgeon. And we have, our surgeons are great here at KUMET. After surgery, not everyone's lucky. Not everyone had a complete remission. Actually, the recurrent rate for this condition is quite high. So meaning that you need a good surgeon to begin with. Some people may need radiation treatment. Some people may need medical treatment. And medical treatment is hard because you're not treating the cause. You're just kind of batching. You're just, patching it. The symptom, just treat because you have high cortisol. You give medicine to slow it down, but you can't really get rid of the tumor.
I want to talk more about this so-called minimally invasive procedure and surgery here in just a moment. So if you have questions, you can drop those in the chat on YouTube or Facebook. You can email the Medical News Network. The information is right there on your screen. So this was, again, technically speaking, this was kind of a minimally invasive surgery. They didn't need to cut open your skull, thank goodness. Yes, thumbs up. But they did go up your nose and through your sinus, which I don't know about you, but that sounds pretty invasive to me, a little uncomfortable. But were you concerned about the idea of this type of surgery, or just happy that it wasn't majorly invasive?
I was really happy that it wasn't, I didn't have to worry about my hair.
Good.
I also, the ENT, he was great. So was the neurosurgeon. They explained everything that was going to happen, that it was going to go through my nose and it was going to just go up that way. So I know that they had told me afterwards that if I had any clear fluid coming out of my nose, then that would be concerns for cerebrospinal fluid, which nobody should have coming out of their nose. And so, just getting that information, knowing that my sense of smell would be gone for a while. During COVID, nobody wanted to be able to have their sense of smell gone, because then they're worried, do I have COVID? So, not only that, but this is also going around that time when everyone was completely being masked, and
no stress there at all, right?
Yeah, no additional stress there. Just, So, those different things, just seeing him go through, just, thinking about that.
It doesn't sound pleasant.
No, but at least, like you had said, it's not more surgery than needed. So
that's good.
Yeah.
So in recovery, how was recovery? Pretty good? Take a lot of time off work?
I wasn't able to be a passenger in a car for the first month without getting lightheaded or dizzy. Walking, sometimes I would get dizzy. So it took about the whole 3 months, post-surgery, and then when I got to work, I was completely exhausted. And so my boss was so wonderful. He let me have a little bit lesser assignments at that time, or just lighter workload, so this way I could reacclimate back to work. So
how long did it take though before you noticed those changes in your energy level and your mood? It just changes back in your body to what you remember it to be.
Probably the full 12 weeks off. I mean, I had to have somebody home with me. My mom was home with me for at least that first month, just because I couldn't do much of anything. I mean, my cortisol level was nothing. So I had to be on oral steroids. And then I just got off those oral steroids, like a year ago?
Yeah, it's a long time. You've been on for like almost a year or something.
Dr. K, is this a pretty typical result? 90 days out, then we start getting back to normal levels?
It's just so tough. I couldn't imagine. Basically, so like I mentioned earlier, with this condition, it's not uncommon to recur. And of course, that's the worst thing. You don't want recurrent. But on the other hand, if you don't have recurrent, it means you're going to have too little cortisol. And that is when people need supplemental pills. So, we have the pills that we use. It's either hydrocortisone or prednisone. And we are giving them just the minimal, the least amount that they can use just to survive. And that is very challenging.
How's life today?
Fine. I do my best with what I can. Some days I'm a bit more fatigued than others, but I try to just do what I can when I can, and maybe I might overdo it some days, but you know what? I'm trying to be out there for my kids and stuff and family. So.
Let's bring up family and kids. And I know you said you had, I'm sure your family has been such a big support. You mentioned your mom, and tell us a little bit about everybody.
Well, I have 2 very active kids. They are in swim, so they're at swim practice right now.
My kids are swimmers too. Yeah, that's fun.
All City is on Wednesday, so that's where they're at.
Good.
So my sister has them. So either my mom or my sister will take care of them during the day or something, and then we have like my dad and my in-laws that also take care of the kids, and we'll do like either evenings or overnights with them, just so this way we can do things. My son and I just got back from Camp Nash last week. As people that are there now, you're not having it as hot as we did last week. Yeah. So I just try to be as active with them as possible. We get passes to amusement parks and
you do what
like
you can
that.
when you can do it, and then when you
Yes.
can't, you lean on the people who are there to help, it sounds like. So
Yeah.
that's really good. That's
So,
good.
yeah.
Dr. K, what's the difference? There's Cushing's disease and then
Right,
Cushing's syndrome. Is it important to distinguish between the two?
It's good to know that syndrome is, anything that causes excess cortisol, and it could be actually more common is if someone needed to be treated with steroid for outside conditions. So not uncommon if you have COPD or if you have rheumatoid arthritis. So syndrome means any cause of excess cortisol in your body. It could be from outside, it could be from inside, but the Cushing disease is only if the cause of excess cortisol is from ACTH from your pituitary. So
Very
in
specific.
fact, there is less common cause, like your adrenal glands has tumors and they secreted cortisol by itself, or like I mentioned earlier, we have a condition called ectopic ACTH, Cushing, and that ectopic rare, but it could come from a spot in your lungs or some kind of other process.
What would happen if this was left untreated for too long?
So Cushing's syndrome, too much cortisol is really hard on your body, so not just the weight, not just the appearance, it makes your blood pressure goes high, makes your blood sugar goes really high, it make people prone of bone loss, steroid causes bone loss, so osteoporosis, they can have blood clot, and all these, if it's massive, not treated, definitely increase to higher mortality.
What would happen if this was left untreated for too long?
So Cushing's syndrome, too much cortisol is really hard on your body, so not just the weight, not just the appearance, it makes your blood pressure goes high, makes your blood sugar goes really high, it make people prone of bone loss, steroid causes bone loss, so osteoporosis, they can have blood clot, and all these, if it's massive, not treated, definitely increase to higher mortality.
Let's get to some questions from our viewers this morning. Jeremy wants to know, does Cushing's symptoms overlap other things and make it hard really to lock down what the issue is, I would imagine?
Yeah, that's a really good question. Basically, it's different when you have like chronic and, just consider mild to moderate symptoms, because it's common to not be able to lose weight. It's common to be depressed, mood, everything. And to make it more complicated, these symptoms can cause falsely abnormal tests that I'm running, those 3 tests as a screening. If it's minimal, you can have mildly off of the, so we have a term even, it's called pseudo Cushing. It's very interesting. So basically, if you have obesity, if you are chronic depressed, if you have PCOS or sleep apnea, those are very, very common conditions. You can throw these tests off, and that's why I said, you need to be set. You need to be fixed on very drastic abnormal 2 out of 3, and for each test, you needed to have repeatedly abnormal tests, not just mildly off
to
tests.
be diagnosed with the disease.
Absolutely.
And that's probably why Cushing's symptoms and syndrome comes up a lot on our program, because it's caused by something else coming in. Couple more questions. Amy wants to know, does this affect men or women more often? Do we know?
Cushing disease more common in women.
Okay.
I think it's around like 3 times more common. Typical age 20 to 50. So these are classic type. When it happened in men, that's when you think a little harder. Is this really Cushing disease or something else?
Question, Dom, what advice would you have for somebody as far as like symptoms to look for, to say, don't let this go too far, don't mistake this for something else? When along the line did you go, ooh, this is something different?
I mean, my weight had gone up even higher than when I was pregnant with my kids. So, I would think that if you're that uncomfortable, that this is not how you would normally be, or your fatigue level, be an advocate for yourself and just be like, hey, can we double check this? It's not that hard. I mean, some people might be a little bit more, late thinking, I don't want to bother my doctor. I don't want to be looking like I'm just seeking, but you also want to seek the truth for yourself. And so I know that can be hard for some people to reach out or to even go to a doctor. And I think that's where there's still that stigma of, I don't need to see a doctor. But if you know that something's not right, you need to ask questions.
So, Doc, we said this was a rare disease.
Yeah.
Is it rare because a lot of people don't even know to get tested for it? They live with it. We never hear about it.
It's rare. It's probably 10 per million cases. It's not common.
But it exists.
Right.
Is it not commonly diagnosed, or is it just, okay, but we know it's out there.
Hard to diagnose.
Which is why we're having this conversation. So
and that's why it's important to get appropriate testing.
And start asking those
looking into
questions.
this, yes.
Dom, what do you want people to take away from your story?
Don't be afraid to ask questions. That's what your doctor or even your family is there for. I mean, my husband's my rock, and he would be like, well, honey, if you need to do this, we'll make it happen.
Ask questions, know your body. Dr. Conchanason, what do you want people to know? What's the big takeaway from our chat?
I probably would say, Cushing's there, and, as more than routine, it's not like, everyone should be screened for Cushing, of course, but everyone should be checked on the cortisol, steroid exposure. That's one thing that some people are not aware. They've been getting injection every 3 months. They didn't know what could, impact their health in that way of the Cushing could impact because you're receiving steroid. And then another thing would just be, with weakness, I forgot to mention one thing's important is Cushing impact a lot of your muscles, so you'll have a lot of proximal muscle weaknesses, which is a different kind of weakness. So this is the muscle that you use when you just squat down and rise up. Those are really weak. The muscle you use to climb stairs, so those are unusual. In general, we see people who have thyroid problems. They may have weight problems in our clinic, and we tried more specifically just to focus on those clue that they may have Cushing, and then, we get them tests for it.
Again, we've heard the word Cushing's on this program many times, so thank you both for being here just to help educate us
Absolutely.
on what exactly it is and where it comes from. So thank you both. Thanks to our guests. Thanks to our viewers for being with us today. We'll see you back here on Wednesday. Coming up Wednesday on Open Mics with Dr. Stites. As all eyes turn to Paris for the Summer Olympics, we explore expert care for elite athletes. I'm Jessica Lovell on the next Open Mics with Dr. Stites. Meet gold medal Olympians who chose the University of Kansas Health System to keep them healthy. Wednesday at 8.
Subscribe to our Morning Medical Update and Open Mics with Dr. Stites podcast. Now, everywhere podcasts are available.